So good afternoon, everybody. Um, we have been part of this group for quite some time and learn every time and always trying to utilize something to benefit us out here. And as we were planning this meeting, it kind of kept occurring to me, wait a minute, I might actually have something to contribute to this meeting. And that is under the fourth goal, I'm going to put them in Rose Talk. We kind of looking into interventions and supports and so forth, kind of thinking outside the box, right? And most of you know our story. That's kind of what we did with the Learning Center. Just to give you a timeline, back in 2018, many of you probably know, Mary Guerin, got a hold of me and said, Rose, I got these awesome ladies down in Dubuque that I want you to meet. And they came and we talked, and by gosh, they started their licensing procedure in 2019, and we're actually up and going in 2020. And folks, aligning all the stars here, what's been presented right now and what's going to come from Miss Kara here from Unified Therapy, everything lines up in all this talk, because what we've done now is been able to bring high schoolers in and say, you like working with kids, you don't want to go into education, here's another realm for you. So we're trying, Becky, we're trying to funnel them your guys' way and every other way, trying to get these kids to think out of the box while we're providing therapies out of the box. And folks, I just want to give Unified a tout, because not only are they working with families and students directly, but they're going into daycare facilities and helping try that early intervention, get that found, and get these kiddos caught before they get into our K-12 system. With that being said, they're currently serving, I believe, between 15 and 20 families in Kara. That's quite a feat right now in these days. So I'm going to pass it off to you and say thanks, and hope you all enjoy the information.
Well, thank you everybody for having me. Can you hear me okay? Okay, I just want to make sure my microphone was working. Thank you. I appreciate the opportunity to speak with you all, and I appreciate Rose and kind of getting this up and going for us. I really appreciate the opportunity. Yeah, yes, we are Unified Therapy Services. I have been with I've been with Unified Therapy for 13 years now. I'm an occupational therapy assistant by trade. So I have been doing that for over 16 years now, as well, in addition to my rehab director role. Oh, I'm so sorry, I could screen share. I do have a slideshow as well, unless, I don't know, Nicole, do you want me to run that or I can run it?
Yeah, if you're okay with running it, go right ahead.
Okay, do I need to request permission?
No, it should let you.
Okay, sorry, I usually use Teams, so I'm trying to, oh, they're right here, right in front of the screen. I apologize. Okay, are you able to see the PowerPoint? Okay, that's better. Sorry about that. So yeah, so I have been the rehab director now for 6 years. As well as in addition to my occupational therapy assistant degree and treating as that. Here we go. Okay, so we provide occupational therapy services, speech language pathology services, physical therapy services. We also provide feeding therapy intervention, and we also have applied behavior analysis services. And right now in Fenimore, Wisconsin, we are offering OT, speech, and the feeding therapy with goals in place to provide physical therapy here in the near future. So we're very excited about our growth. We continue to look forward to growing even further as well. We opened in Dubuque, Iowa in 2006. The two owners got together and realized there was no real therapy intervention for pediatrics in the Dubuque area. So they both relocated up here and opened the business here in Dubuque in 2006. So initially the focus was pediatrics, and then we learned that there's a lot of that neuro population that grows up with autism, they grow up with cerebral palsy and Down syndrome that still need intervention services as well. So we started accepting more adults that have the neurological impairment as well in our facility. So with those two services that we were offering, we quickly grew and needed to change locations because the space wasn't big enough to where when we had started. So, and that was within a span of two years that they had grown that quickly, from both of the owners being a PT and speech, and they hired an OT, and then growth from the staff of 3 to now we have 40 plus employees working for Unified Therapy Services. So we started out in the peds and neuro world, and then we started to get more of that orthopedic background coming in as well, in addition to the other two populations that we were serving. So they continued to be doing very well. And so we decided, the owners decided to open orthopedic based clinic just around the corner in a small space. And that was in 2012. And within 4 years, we had outgrown those walls and needed more space as well. So ironically, we have two places right next door to each other, the ortho side now, and our pediatric and neurological clinic that we are also offer services. So those two continued, we continued to do well. And then the opportunity came in the same year. We were talking with Rose about the Fenimore Clinic, as well as a satellite clinic downtown Dubuque, because we were on the west end of town. And we knew that tri-state area was driving all the way across town to get to us, which was adding another 20 plus minutes to their drive. So what we did there at the downtown clinic was combined both our orthopedic population and our peds neuro population all into one. So it's both of one of those smaller versions of the two clinics on the west end of town, down at our Elm Street clinic down in downtown Dubuque. So it's right across of the river, right when you pull into town. Within that same year, we were working with Rose at the very same time. We were working really hard to open the Fenimore Clinic. We started the paperwork process, as she mentioned, in 2019. Of course, then COVID hit, so our opening date in the Fenimore Clinic was pushed back just slightly, but we did manage to open in August of 2020, which we were very excited about. So we started with speech therapy services when we opened, and we were very excited to say now that we're open with speech therapy services 3 days a week there. And then with just this last year, we were able to grow into occupational therapy as well. So we're also providing occupational therapy 3 days a week there as well. Of course, we have a goal in mind to be there open full time, as well as add our physical therapy services, and the potential to maybe, we do have some ABA services in Dubuque, so there might be a potential to have a little bit of that support in the Fenimore Clinic as well, in addition to the speech, the OT, and the PT and at Fenimore. I don't know if many of you are familiar with feeding therapy, but we do provide that intervention as well. So a lot of our therapists are trained in the SOS approach, which is sequential oral sensory approach to feeding. So we have several members that have that certification or getting it in the process of this month here coming up, actually. And that is a great service that we offer to get those kids and patients, I should say, individuals, eating a more rounded diet. As we know, especially on the spectrum, they tend to be very picky and selective about their food choices. So we feel like that is a very big benefit to the patient population that we serve. And speaking of the patients that we serve, of course, some common diagnoses that we see include autism, cerebral palsy, Down syndrome, but also just that developmental delay. They don't have a formal diagnosis. They might not be on the spectrum, but they're just not, articulation. They're not having that language base. Their OT fine motor skills are poor. Maybe they're just not developmental gross motor wise either. So we also take a lot of that population that doesn't actually have a diagnosis of some sort, but they need some early intervention services. A lot with sensory processing disorders in occupational therapy, we come up with sensory diets, provide the family with education on the importance of sensory diets and how it's co-linked with autism and ADHD, but it can be seen by itself. So we talk about a lot with our therapy services as well. We also have genetic disorders. PT does a lot with torticollis, which if you're unfamiliar with that word, it's when babies are tilting their head to one side, which is oftentimes can cause a lot of problems with rolling and your gross motor skills and ability to cross midline. So it can cause, it can cause problems if we don't get that corrected right away. So our PTs work with home programs with parents in that service. Of course, if there's a traumatic brain injury, just language disorders, and again, those feeding difficulties. And as I mentioned, again, we see a lot of patients that don't actually have a formal diagnosis. We just go off of the treatment diagnosis and the symptoms that they have. So a lot of you might be thinking what kind of the differences are in between our outpatient services and education-based services. So I just have a little slide here of an outpatient therapy. Our qualification criteria is much different than that of the schools. We use standardized testing, but also a lot of times we don't have to have standardized testing. If we can justify with our assessments and interventions, then a lot of times services are covered if they're showing dysfunction in just one area. So let's say, I'm an OT, so let's say they just can't, the fine motor isn't there, right? I don't need, I could use a standardized test, or we could kind of assess it's impeding their function because they're not able to zip their coat, tie their shoes, button their shirt. So if it's impeding function in that area, we can pick up for those services. So this means we are sometimes, however, restricted, of course, then by insurance companies, because we do need sometimes the prior approval for insurance to be covered depending on their insurance company. But we also, sorry, I'm reading my notes here. We are very strong on the parent collaboration. We very much believe they're a part of our team. We want them to participate in our therapy sessions. We want to model what we're working on so they can carry over those skills into the home. It's very important that they work on those things at home because we know progress is better if the parents are involved. And, it's hard to make progress when they're coming once or twice a week for 40 minutes at a time versus the parent caregiver is able to work with that person, that patient a lot more, and then the progress is better. We, of course, want that highest functional potential as well. So, and as Rose mentioned, we can treat in natural settings as well. So as a rehab agency, we have been able to go into the daycare settings, which is great because we also, like your drive here, we also want early intervention, right? Everybody thinks that. We've all seen the research there behind that. So what we do is we go into daycares and provide free developmental and social emotional screenings. And so we've started that several years ago because we too were wanting kids younger. And so a lot of the child care directors now allow us to come in and we complete the screenings and we say, hey, there's a little bit of a red flag here that you might be interested in an evaluation to see if services are beneficial, because the screening's not formal, it's hands-off, it's observation, but we're pretty good judges of being in the therapy services to kind of, determine that there's probably something that could be there. So, and then it's up to the parent to say, yes, I would like to pursue services, or no, maybe not. But we're just at least letting people know that there might be something there and that we can help in that way. So our purpose here in Fenimore, Wisconsin, of course, we wanted to help hit those individuals in the rural areas. We knew that Southwest Wisconsin, a lot of parents were coming all the way from, we had patients coming from Platteville into Dubuque. We've had patients coming from Cuba City, several areas into Wisconsin, driving all the way to Dubuque. So we really wanted to help the Southwest area in Wisconsin. And that's the main reason, for us opening there, so we could reach more of those rural families that really benefit from services as well. So, of course, we also want to educate and collaborate with the schools, the community, other entities about our services that we offer. We just really big on educating the community, parents, anybody that wants to know about our services, of who we are, why we're here. We just really want to support any of those therapy service needs. So some barriers that we're seeing here, obviously, is that we're newer to the state yet, right? I know, I can't believe we're going into 2022. But what we're seeing is a lot of the insurance companies here, if they have services in the schools, they're saying if there's any indication that if services are duplicative, they're going to deny for us. So we're really trying to work on our PA process. We're really trying to make sure that we're not working on the same things. Our therapists work really hard to get the IEPs. So what we're trying to do is find grants. So if anybody of grants that help support individuals with that maybe insurance is denying because maybe there's a different provider, but that provider is 2 hours away versus we're right there, so we're just trying to help find other ways and means for families to pay for services as well if insurance is not going to cover. So that's one thing that we're trying to figure out the bits and pieces for, being new to the Wisconsin area. The transportation, of course, like here in Dubuque, we do have, busing and other cabs and other ways for patients to get to us. Whereas being in the rural area of Fenimore, we're kind of restricted to being, having the parents being able to get the kiddos to our therapy services. So that's just one thing that we're trying to work through still as well, being newer to the area, of how we can help get kiddos, or I shouldn't say kiddos, but all of our patients to us. The other thing is we are not here to replace any therapy intervention in the schools. We want to work collaboratively with the schools. And so we just really want them to know we're here to support the team, not to, we don't want to, push the school therapists and the school people away. We just really want to work together to provide therapy services. And that's our big thing. Even in Dubuque, we work with the school therapists. We're not there to replace anybody. We think we're all of value, and we just really want to work as a team. Another thing is of course, a lot of our appointments are not able to happen because of school during the day, right? So that's the other thing is we're trying to go out to the daycares and other places to help see those kids at different areas at different times of day. And so sometimes then our appointments are restricted to the after school times, and then we only have so many with the staffing that we have that can come after school. But those are things that we're trying to work through. Dubuque, like I said, we're going to daycares. We have the preschool kids that come in the morning. So we know that population's out there. We're just trying to find them. And let them know that we're here. The other things that our therapists are telling us is that parents are concerned with some of the interventions in schools, saying that they're graduating a little bit, but the parents maybe aren't necessarily agreeing with how things are being left off for therapy services in the school. So we're trying to work through that with the families a little bit. Obviously, it's not our place for the school to say that they are or are not. That's not our place, but this is just some feedback that we're hearing from parents, that they're a little disappointed sometimes if services aren't going to continue in the schools anymore. And then again, the insurance, we're just really trying to work with the providers and become in network with a lot of places. Things that we're, trying to break down or work through is there's already a provider in that insurance. Well, that place, let's say that doctor's office is actually referring to us because they don't have anybody to provide that service. So we're trying to inform the insurance companies that, okay, you're saying they're in a network, but we also don't have a person in that's able to do that same service that we are. So we're just trying to work with those insurance companies and break through those barriers as much as we can to become in-network providers for a lot of the therapy services. So those are some things that we're working on. So I also went pretty quickly there, so I apologize. But that's a little bit about who we are, how we came to be in Fenimore, and a little bit of things that we're working on in this area. So does anyone have questions for me? Sorry, that was fast.
Oh, that's wonderful. And we do have time for questions here. And I just wanted to comment as we wait to see if folks have specific questions. Now that we are on virtual meetings, everything goes by much more quickly. So we appreciate your effort to share out what you're doing in such short sound bites. But today, between the lightning rounds and this, we're hearing a number of ways that different programs or localities have worked to make some form of intervention or service support available to families who weren't able to access that in that program or in that area. So I'm listening to all these with a mind to how these might give us lessons that can translate over to other efforts where we might be trying to get services in place. But any questions for Kara specifically about the expansion of intervention here into the Southwest area? I see Meredith's hand. Go ahead.
Kara, you talked about it, but I'm just wondering if you have like specific strategies or details that you could share about like when you were new coming into Fenimore. And I think what I heard you say was that it might have been before the pandemic started. Kind of how did you, are there ways that you tried to get to know the community, share? You talked about like, working with schools and daycares, but are there other things that you did? And then after the pandemic, did you find yourselves having to shift, your strategies for outreach to the community or not? Just wondering your thoughts on that.
Yeah, so we spent a lot of our marketing. We actually did the every door direct mail as well for a lot of the families. So we did flyers that were sent to the people's homes to let them know that we were new in town. Of course, we went to the physicians and let them know that we were new to the area for the pediatric services. We were sending flyers. It was still the pandemic, so we also did telehealth intervention, which we are still doing. So we let them know that, hey, if we're doing teletherapy, and a lot of our appointments were by teletherapy actually yet at that point. So we let them know that was a possibility, and especially for those families who couldn't drive and can't drive, it's still a nice possibility for them as well to provide that option. So we were putting ads in the newspaper up there to let people know in Fenimore that we were there. So we were trying several marketing strategies to inform people about us being in the community that way, to at least let parents know that we were coming there and what we were about. So, yes.
Thanks.
Yes.
What was really cool with that too was I was getting messages left, right, and center saying, "Hey, Rose, good job bringing it." And I'm like, no, it's not me, it's company and so forth. So that gave us contacts because it was like daycare providers or church groups and whatnot. And I'm like, okay, take your flyer. I was able to give them ideas of where to put it on their bulletin boards or who to share it with too. So
Yeah.
their mailings got a response.
The other thing I forgot to mention is we always offer free developmental screenings all the time at our facility. And I can't believe I forgot to mention it because it's a huge part of who we are. But we also did several free screening days before we were actually open. So we were up in the facility offering free screening days. And that's actually how we got the first few patients that we had, is we were sending out flyers, letting them know, hey, we're hosting free screening days. And so that's the big one there, is actually how we got a lot of families to come and get to know us. But we like the free screens because you get to know it's a fun, friendly The atmosphere is different than a doctor's office. You know, it's a lot of the kids just are at the doctor so much and it's scary. And we just want to tell them we're not scary. This is fun and it can be fun and we're here to help. So we like the free screening aspect of parents getting to know who we are, what we're about, and we get to tell them about our approach to therapy and that we want them on the team. It's not just us. So, yeah.
That's great. I see Ida had a question in here as well about, was it a targeted group that you sent mailings to?
I don't believe so. I think we just did the zip code radius for so many towns that were in the radius of the Fenimore Clinic. So it was not, it went to all homes, adults too. It was just by zip code. So.
I'm thinking about parents in the local parent champions like Rose, a rural area, and wondering if, Rose or other local folks were also a big part of the promotion there, getting the word out to people.
Yes, Rose definitely helped us as well. She was our driving force as well. And we're so appreciative of that. Absolutely. Yes.
Not surprised. And it seems to me like wherever we're doing this kind of expansion or trying to start something new in a new area, those local connections are really critical, just to know where to reach out. How did you get word out about, when you offer the free screenings, are you able to connect families with the local birth to 3 programs for referrals as well? Happy to provide some connections within Wisconsin if you might need them. And I was going to ask about the free screenings and how did you get the word out about those themselves?
That's a great question. I felt like it was a couple of years ago now. I know we did a lot. I know Rose helped us get the word out to a lot of the people that she knew. I believe we posted it in the paper, I want to say, but I'm sorry, I really can't speak so 100% on that one, that it was in the paper, but I know it was a lot of Rose informing people that we were coming up to that area to provide the screenings. And then in terms of if we make referrals out to other places, yes, we also, that as part of that collaborative approach. So if we're noticing that they benefit from both intervention services, then we of course are doing that as well.
So one of the other things that Kara doesn't quite know about from the beginning of all this is, like she said, they already had established clients from our area driving down. And Becky talked to that point as well. People as north of Boscobel, which is, we're talking, they were almost doing a 2-hour hike one way to go see them at Unified. So they already had connections made. They already had some school districts that knew that they weren't a threat coming in. So it was just easy to grab that low hanging fruit and start there first. And then I would say actually COVID made it explode.
Yeah, that's interesting. And I see questions and comments that relate to connecting. So connecting to other resources. So this is interesting. Barbara Katz is asking, during the screenings, were you then able to refer families to professionals who do diagnostics, or I would say by extension, any other step they might need, which in a way Chris is speaking to when she's asking.
I'll be honest, at the time, we don't know all the things we can offer. So we would love to get to that point to know all of these resources available to families. That would be 100% our goal. But at the time, we were just trying to get our name to the Fenimore area and see if there were people who needed us for therapy services. But that is totally our approach. And we hope to be able to be that resource guru for these families. We have that in Dubuque because we've been here since 2006, and we intend to be that way in Fenimore. We just aren't maybe knowing all of the things that are here yet. So
Kara, I just want to give you a little heads up to help me remember this. Somebody reached out and said, hey, don't forget to send our brochure home with every family. We've got a wall full of brochures, folks. If you want to get them to me somehow, we can absolutely start making that a priority to send those. But also the other thing with all of this is know that these wonderful people coming in have no problem texting me saying, Rose, can we give the family your information? Can you help them keep accessing resources? So that's why I call this a partnership, because we kind of feed off of each other in some of this.
I see there are a couple other comments there for you, Kara, about people wanting to connect up, about Learn the Science Act early, or lead screening. It makes me really think about the ways in which we can partner and collaborate, and locally, but across state partners as well, to help each other understand what we could be sharing or what someone else could be sharing. Certainly helps us all connect to families and help families get what they need more. So